The inactive lifestyle, being overweight, prolonged journeys by car, and various other degenerative processes to the spine can alter normal morphology and cause chronic pain syndromes in a large number of people belonging to any age group starting from 25 to 30 years. The pain is typically caused by the neural structures of the spine in a specific area. In this region, local irritation and inflammation of the tissues generate the pathological state which, if not cured within a reasonable time, can become chronic, causing sensory or motor disorders. In this typical clinical picture, not only are local regions involved, but also peripheral associated areas such as hands, legs and feet, where the nerve fibers that originate in the pathological area branch out. Intervening externally, drastically interrupting the triggers which would thus vanish, is the only real way out for gradually regaining the lost lifestyle. Today, this is made possible by a modern, minimally invasive technology that uses electrical principles to treat and cure chronic pain. The Pulstrode system is the newest innovation in biomedical science. The thin 1.3 mm lead is positioned on the sick target structures and radiates a bipolar radiofrequency field on them. The system makes use of the newest pulsed bipolar radiofrequency fields with variable length, making it possible to obtain the maximum attainable benefit from consolidated radiofrequency treatments on the nervous structures. With the Pulstrode system, radiofrequency treatment may be integrated with direct pharmacological administration in the exact area of suffering, favoring the perfect success of the treatment. The patient undergoing the procedure is laid on a bed in the prone position. A local anesthesia is effected in the coccygeal or paravertebral area, where the access introducer will then be inserted. The entire procedure will be conducted through this introducer needle, which is only 2 mm in diameter, and the patient will be awake, or at most mildly sedated. Once inside the epidural space, the lead follows a path until it reaches the inflamed nerve area. This operation is conducted in fluoroscopy through a luminance amplifier or designated machinery. With the Pulstrode in position, electrical stimulation tests are then carried out. The length of the bipolar field is modulated with the microswitch, thus obtaining the exact configuration for the radiofrequency treatment intervention. This technique is extremely accurate because it is conducted with a patient who is awake and will report the location of the stimulation evoked, thus contributing to the exact positioning of the lead. Once the optimal position has been found, the radiofrequency treatment begins. The external generator connected to the Pulstrode creates high-frequency bipolar-type waves, which are conveyed inside and up to the sick root through the action of the catheter's electrodes. The treatment lasts 5 minutes at a temperature not exceeding 42 degrees Celsius. After the first application, the treatment can be repeated on other nerve areas considered important for the success of the intervention. The Pulstrode catheter is also designed to be left in place after surgery, if the indications so suggest, for the duration of a few days. The treatment carried out can also be combined with low-frequency but continuous stimulation for 48 to 72 hours. Further administration of drugs is thus also possible during this period of stay. The external low-frequency AccuStim stimulator is fully programmable and supplied to the patient. Effectiveness on many signs of diseases of the rachis. Simplicity and accessibility possible thanks to ease of use. And extraordinary results with the disappearance of pain today make Pulstrode the maximum expression of technology in the science of minimally invasive pain therapy. A new and effective option for all sector professionals.